Care that makes a difference. Brought to you by Doctors Hospital of Laredo and Laredo Physicians Group.
My name is Osama Jamil. I am a neurologist and the Stroke Center Medical Director at Doctors Hospital of Laredo. Let's talk about stroke. A stroke happens when there's damage to the brain caused by blockage of blood flow to the brain or the rupture of the blood vessel that supplies that part of the brain. Stroke is a serious illness because brain is made up of cells called neurons, and the neurons die when they are starved of oxygen. About 1 million neurons die each minute. Everyone is left untreated with a stroke. So there are two main types of stroke. One is called an ischemic stroke, the second is called a hemorrhagic stroke. Ischemic strokes, which are the most common, are caused by blockage of blood flow to part of the brain. The second type of stroke, which is relatively less common, is called a hemorrhagic stroke. This happens when the blood vessel supplying the part of the brain ruptures, or if there's an abnormality in the blood vessel and that causes the blood vessel to rupture, causing damage to the brain. Texas is part of the stroke belt, meaning that we have a higher incidence of strokes in Laredo and overall Texas compared to the rest of the country. More specifically, South Texas and Laredo has a higher incidence of stroke compared to the national average. The reasons are manifold, poor health compliance, health disparities, socioeconomic disparities. All of those contribute to us having a higher incidence of stroke compared to the rest of the country. Stroke is a medical emergency because every second you delay stroke treatment, that increases the chance of you being dead or significantly disabled. It's very, very important that as soon as stroke symptoms are recognized, people reach the hospital via 911 so that we can see what treatments they're eligible for and try to reduce their risk of disability or death.